Thanks very much, Mary, and can I also welcome you all to the Scottish Parliament and also praise Allana for organising tonight's event. Good to see you all here, and I hope you have a really good and interesting evening. I'm sorry that it is, as Mary said, only a brief visit. I have got another engagement to go into for 6:30, but I did want to at least spend a little bit of time with you. But my particular apologies to the young people who are going to tell us about their own experiences. But I do have, where's Will from one of my special, Will here will be here, and I'll get some feedback certainly on the experiences from the young people. I know the main purpose of the event is to launch 2 children's booklets about epilepsy, one reflecting a child's own experience, the other from a parent's point of view. And these kinds of first-hand accounts I don't think can be beaten at all. I think they're so important in really helping us to understand people's concerns and the sorts of services and support that they are looking for. And we often think that long-term conditions only affect older people, so it's good to be reminded that they affect children and young people too. Of all the long-term conditions, epilepsy is one that needs a lot of information, and that's probably because it's a complex condition, but it's also because people don't have it. The people who don't have it often get hold of very odd ideas about it. There's a lot of sort of perceptions out there and some myths. And, many years ago, it was a lot worse than it is now, and terrible things were done to people who had epilepsy. But there's still that misunderstanding and a bit of fear around the condition. And a lot of work's been done to overcome that, but I think it's fair to say we still have a bit of a way to go. So we need to make sure that everyone gets really good information about what it's like to live with the condition. That applies to doctors and nurses as well as children and their parents. And I know that this is something Epilepsy Scotland does very well, and I'm pleased that the government has been able to give them a bit of money to help with that part of their work, and some of it may even have gone into these 2 booklets. The other people who are good at providing information and support are the people involved in the Scottish Paediatric Epilepsy Network, and it's one of the things we expect any network to do, to make helpful information available to people when they need it. And they also provide other kinds of support too, so that people feel that they're not having to cope on their own without any help from anyone else. And I saw from the network's website that they've got very good links to all the information that Epilepsy Action have put together about the sort of things youngsters and their parents need to know about. The other really important people in all of this are the epilepsy specialist nurses, especially the ones for children and young people. And I know that there have been concerns raised about protecting their time as specialists, and indeed this was raised with me at the cross-party group on epilepsy a couple of weeks ago, and I promised I'd look into the issue, and I have taken that issue up with NHS boards, and I will be getting back to the cross-party group once I've been able to check out the position more fully. We're also aware how important it is that young people make a good transition from children's to adult services, and the network has developed a transition care process. It's essential that all teenagers who can do so are able to take part in discussions about their care and that they're involved in that transition process. And I think that the network is also quite right to want to be able to offer them the chance to be seen on their own if there are issues that they want to discuss privately. We've now got clinical standards from NHS Quality Improvement Scotland that set out what all the elements of a good epilepsy service are. They're something that all boards are going to have to meet, and that'll be a tough challenge. They apply to people with epilepsy, whatever their age may be. But we need to be clear that they should be used in a way that has maximum benefit for children and young people, and we'll be taking that forward with boards and monitoring how they implement those standards. But at the end of the day, this is an evening for celebrating what young people with epilepsy can achieve. It also shows how their passion and enthusiasm to take things forward will eventually bring about the changes needed for a fairer society. So enjoy the evening, and as I say, I'm sorry I can't be with you for the whole evening, but I'm sure it will be productive and I'll hear all about it. So thanks very much for the invitation. Thank you.